What is multimorbidity? Multimorbidity means lots of separate health conditions in one person at the same time. The reason it's important is because it leads to a whole host of difficulties, like reduced quality of life, reduced function for people living with multimorbidity, a massive increase in the use of healthcare, which has an impact on the cost of healthcare, and a wider impact on society more generally. It also causes shorter lifespan. The things that professionals ask of and prescribe for people living with multimorbidity can be a lot to cope with. Having 2 or more long-term conditions can make it really difficult for someone to follow healthy living advice. Ultimately, it can affect the confidence a person has about being able to achieve what they'd like, and in the long term can impact their social functioning, leading to social isolation and depression. It is quite important when we talk about multimorbidity to be clear that we're not talking about another term that is often used called co-morbidity. Co-morbidity also means you've got 2 or more health conditions at the same time. However, in comorbidities, there is what we call an index condition. This is one condition that comes first and has caused all of the other conditions. The key feature of comorbidities is this one disease which has led to the development of other diseases, so that if you treat the first disease, the person generally starts to feel better. For example, if you're diagnosed with diabetes, you might end up getting an eye condition called diabetic retinopathy, and you might get diabetic foot ulcers. Treating the diabetes would see a reduction in the progression of the eye and foot disease. Multimorbidity is different in that there are lots of long-term conditions but no one condition that has caused all of the others. A person could have arthritis and chronic obstructive pulmonary disease and eczema and liver disease. No one condition caused the other condition, and if you treat one condition you wouldn't see an improvement in any of the others. This makes multimorbidity very difficult to manage and to live with.